Hi everyone, so today we are going to begin our discussion of Chapter 14, which is about therapies. And this PowerPoint will cover pages 548 through 551. So it's important to know that people seek help from mental health professionals for a variety of reasons. They might be seeking help because they have some sort of a psychological disorder, but it's not just the people with psychological disorders who seek treatment. For example, people who might be in a troubled relationship, or maybe there's life transitions they need help adjusting to, or maybe they have excessive stress. These people will also seek out mental health professionals. Now, in this chapter, we are going to talk about two broad forms of therapy. And these broad forms of therapy are used by mental health professionals in order to help people. The first one we're going to talk about is psychotherapy. And this refers to the use of psychological techniques to treat emotional, behavioral, and interpersonal problems. There are many different types of psychotherapy, and we're going to talk about a few of them in this chapter. They all share the assumption that psychological factors play a significant role in a person's troubling feelings, behaviors, or relationships. When we talk about psychotherapy, we are talking about what most people think about when they think of things like counseling or simply therapy. So in contrast to psychotherapy, there is also biomedical therapy, and that involves the use of medication or other medical treatments to treat the symptoms associated with psychological disorders. Drugs that are used to treat psychological or mental disorders are termed psychotropic medications. The biomedical therapies are based on the assumption that the symptoms of many psychological disorders involve biological factors, such as abnormal brain chemistry. So we're going to do a little talk about who's who in psychotherapy, because when we talk about psychotherapy, there are a lot of different people who are in that broad umbrella of mental health professionals. So first we have clinical psychologists. And a clinical psychologist holds an academic doctorate, in other words, a PhD, a PsyD, or an EDD. And the person is required to be licensed in order to practice. They assess and treat mental, emotional, and behavioral disorders. They have expertise in psychological testing and evaluation, diagnosis, psychotherapy, research, and prevention of mental and emotional disorders. It's important to know that a person with just a bachelor's degree or just a master's degree cannot become a clinical psychologist. Counseling psychologist is our next mental health professional. A counseling psychologist also holds an academic doctorate, so a PhD, a PsyD, or an EDD. The person must be licensed to practice. They assess and treat mental, emotional, and behavioral problems and disorders. Historically, a counseling psychologist treated disorders of lesser severity, but now there's less distinction between the practices of a clinical psychologist and a counseling psychologist. And again, a reminder, a person who holds only a bachelor's or a master's in psychology cannot become a counseling psychologist. So next we have the psychiatrists. Psychiatrists hold a medical degree, either an MD or a DO, and is required to be licensed in order to practice. A psychiatrist has expertise in the diagnosis, treatment, and prevention of mental and emotional disorders. They often have some training in psychotherapy, and they have the ability to prescribe medications and medical procedures for treatment. So they primarily focus on that biological aspect and the medications that would be prescribed associated with the biomedical therapies. In their own category are the psychoanalysts. So it's usually a psychiatrist or a clinical psychologist. The person has received additional training in the specific techniques of psychoanalysis, which is the form of psychotherapy originated by Freud, and it'll also be our first discussion of a type of psychotherapy as we move further into Chapter 14. Next, we have the licensed professional counselors, and they're typically abbreviated LPC. In Colorado, that's what you will see when you look at a person's licensure, it'll say LPC. A person who's a licensed professional counselor holds at least a master's degree in counseling with supervised training in assessment and therapy techniques. Now, they may be certified in specialty areas. For example, you might find someone who is an LPC And it might say, for example, CEDS, CEDS. That would be Certified Eating Disorder Specialist. By looking at whatever certifications follow, you will know what that person's specialty area is, or at least one of the specialty areas. Most states require licensure or certification for someone who's a licensed professional counselor. Master's degree is likely in something called, it's likely a master in mental health counseling. A person who is a licensed professional counselor has taken a slightly different route from psychology. Psychologists focus more on the biological. A licensed professional counselor focuses more on the psychotherapy aspect. Psychiatric social workers. So in Colorado, we actually look at, we call them licensed clinical social workers, and they're abbreviated LCSW. We look at them as clinical social workers. Pretty much the same thing. It falls under the same broad umbrella. So this person will hold a master's degree in social work, which is an MSW. Trainings include an internship in social services or in mental health. The person usually has certification or licensing and may have some training in psychotherapy. Those who have the training in psychotherapy and who have followed that path, those are the ones who are the clinical social workers and would be the LCSWs. We also have marriage and family therapists. And in Colorado, once a person is licensed, they get LMFT following their name, Licensed Marriage Family Therapist. This person will hold a master's degree, perhaps even a doctorate, with extensive supervised experience in couples or family therapy. The person might also have training in individual therapy. Many states do require licensing for a person to practice as a marriage and family therapist. Our last category are the psychiatric nurses. People who fall under this category, they hold an RN degree, a registered nurse degree. They've selected psychiatry or mental health nursing as their specialty. They may or may not have training in psychotherapy, but they've had training in the biomedical therapies. That's their primary focus. So all of these people fall, as I said, under that broad umbrella of mental health professionals. And they all serve various purposes. So depending if you are looking for someone to do just psychotherapy with, or if you're looking for someone to do therapy with your family or a partner, or if you are looking for someone to simply prescribe medications, you would choose these people because of what their specialty is. That's how you determine who you would go see. It would be based upon what your needs actually are. So when treating psychological disorders, the combination of psychotherapy and biomedical therapy, especially psychotropic meds, has become increasingly common. So even people who have something major, for example, schizophrenia or any of those type of mental health issues, they typically will benefit from having psychotherapy in addition to that biomedical therapy or medications. Now, until recently, only licensed physicians were allowed to legally prescribe psychotropic medications. But back in the 1990s, there was a movement to allow specially trained psychologists to prescribe, and there's actually been some success with this. Now, only a limited number of psychologists are able to prescribe medications, and it does vary by state. In some states, they're still prohibited. In other states, it's allowed. An increasing number of these clinical psychologists are involved in medication treatment decisions or have clients who are taking psychotropic medications. So even if they are not the ones prescribing, they may be recommending certain medications. They may have patients who are taking multiple medications. Because of all of this, the APA has actually released new guidelines for psychologists regarding prescription medications. These guidelines stress that the psychologists who are involved in medication decisions need to educate themselves about the potential benefits and side effects of any psychotropic medication. So one other thing I just want to address with this, for example, licensed professional counselors who have that master's in mental health counseling, again, in some states, they are able to prescribe medications. That is not most states, but there are states where they are permitted to do so. And again, they're required to learn all the things about psychotropic medications, the same as a psychiatrist would need to learn, or the psychotherapist that we talked about, the clinical psychologists. So we are going to begin this chapter by discussing psychotherapy. We're going to discuss psychoanalytic, humanistic, behavioral, and cognitive approaches. And then later in this chapter, we're also going to talk about biomedical treatments.